Hello, welcome back. The video topic today is how diabetes affects our sleep. Sleep is very essential, we all know, and diabetes is a very common disease that although everybody knows. But can diabetes affect our sleep? Yes, definitely. In the previous videos, when we talk about the metabolic diseases, diabetes is one of the prime disease where we said, diabetes is one of the main reasons for a stress. The stress is a chronic stress for any person with diabetes. So this stress is most of the time is depression. So when diabetic people are depressed, though they have a good control of the sugar, they take care of their body, they take care of their health, but they will be under stress and depression. So definitely it affects our sleep. So either some people will sleep very, very less most of the time, or sometimes they sleep more. And in diabetes, suppose they have a low blood sugar, there is hypoglycemia. When the blood sugar is low, so the body, the blood sugar to the brain is low, so the heart rate increases, it increases the appetite. So definitely it won't allow them to sleep. So hypoglycemia, by reducing, increasing the heart rate and appetite and sweating and everything, the sleep is disturbed. Then hyperglycemia, where the blood sugar is very high, so the blood sugar rises, so it causes thickness of, the blood thickness increases, so there is a sluggish flow of blood, so they become very tired, lethargic, more depressed, so that can affect their sleep. Not only that, most of the diabetic are obese, so obese people, they may have a snoring, they have a acid reflux, they have a sleep apnea where they stop breathing for some time, so naturally that affects their sleep. And more than that, the complication, one of the main complication or the very common complication is neuropathy, peripheral neuropathy, where the nerves, the peripheries, the blood, the hand and the leg, they get affected. So causing severe shooting pain, burning pain, or sometimes numbness. With the pain and numbness, definitely the sleep can be disturbed. Yes, in fact, they don't get sleep. In fact, the other thing is sleep apnea. Diabetes itself can cause sleep apnea, affecting their sleep. The other one is restless leg syndrome. It is very common in diabetics, and where they have a involuntary jerky movements of the leg, disturbing their sleep. So not only that, and again their mental stress is too much. It's a chronic disease, the chronic inflammation, chronic depression, reducing their sleep. So why we are worried about whether diabetes causing, affecting the sleep? Because with the less sleep, the sugar is not under, will not come under control. The reason being very simple. The circadian rhythm. So circadian rhythm is very essential for the proper functioning of all the body structures, and especially for the hormonal secretion. So insulin is a hormone. If the person is not sleeping properly, the circadian rhythm is disturbed, thereby reducing the insulin secretion. Not only that, see it also increases the insulin resistance. So insulin secretion is low, insulin resistance is more. So diabetes will not come under control. So once the diabetes is under control, the person goes more stress, more depression, causing the vicious cycle. And another very important reason for lack of sleep in the diabetic people, they have a frozen shoulder. The shoulders freeze like a ice, getting freeze. The shoulder, the whole joint becomes freeze, so causing severe pain from shoulder to the back of the neck. The pain will be excruciating in the night time, so they get less sleep or they don't sleep at all. So diabetes can affect their sleep, and sleep directly affects their sugar control. So you get if people with less sleep, diabetic with less sleep, try yeah, changing diet, exercise, or even you have to ask a physician to adjust the dose of the medicine and how to control it properly. And in spite of all these things, if the sleep is very less and that affects your blood sugar level, it's better to take some tablets to get a good sleep, because when you sleep well, the circadian rhythm comes back, and the stress level comes back, so the resistance of the insulin goes, and the insulin secretion increases, and diabetes gets good control. Thank you.